Hi everyone, hope we are doing fine. This is Kunda Priscilla, the acting TB coordinator in the Kanchibie district, and with me I have Mr. Makumba Nkuka, who will introduce himself. Yes, he's going to introduce himself, and today we'll be doing a video on urine LAM. So he's going to tell us what urine LAM is and everything that you need to know. So yesterday I was passing through the facilities and I left these my kits which we used to utilize before 21st of January 2026. And those facilities that received this urine LAM, please watch this video. Those that haven't yet received will surely deliver them. So this will be very helpful for us to do testing whenever we want to detect TB in our patient. So you may have a question to say, who are the people that qualify for the use of the urine LAM that we are about to do? So you can do this urine LAM on people who are on ART. You can do it on malnourished children, whether severe or moderate. You can also do it on those people that have chronic kidney diseases. You can do it on people with sepsis or those that are chronically healed, those that can't move around. You can use urine LAM if you feel like you want to detect for TB. So let's go into the video again and see how the lab tech will do the procedure for us so that we can do this thing on our own.
Morning everyone. I'm Kuka Makumba, the lab personnel at Chalavesa Mission. As Madam Kunda started, we are going to go through this simple POC testing kit, urine LAM. It's called POC. It can be done at any department. Anyone can do it. It doesn't need the lab personnel. A clinician, a nurse can do this one. So this is LAM, urine LAM. I'm sure most of you have heard about it. So urine LAM is an RDT, rapid diagnostic test. The pack comes like this. It's a rapid diagnostic test to detect Mycobacterium species. So LAM is a short form for lipoalbinomannan. It's a mouthful, I understand, so we'll be using abbreviation as LAM. So this is an antigen. It's an antigen which is found on the cell wall of Mycobacterium species. So it's a glycoprotein actually. Most of the time, as a person who has been infected with TB, this glycoprotein is found on the cell wall. So on the cell wall, when it sheds off, it finds itself in the urine. That's how they came up with this diagnostic test using that glycoprotein. So this is how the pack looks like. So when you open it, on top it's a ziplock. It comes sealed. This one was opened before, so you rip the top part up. Make sure you preserve these locks. They are very helpful. So once you open, you'll find these things inside. This one is an insert, a leaflet. This is a standard operating procedure which comes with a kit. Very helpful in case you forget anything. So this one, if you want, you can stick it anywhere where you're doing the tests. You can stick it either in IPD, ART department, lab, OPD, anywhere you're doing the test, you can stick it. It will help you. It's a manual on how to do the test. Then inside, there's also this. This is a desiccant. The purpose of this to sort, to to make sure that there's no moisture in the test. Make sure you don't throw away those. Then here comes the test kits themselves. So these are the test kits. This one, like I said earlier, we've opened it already. So these are the test kits. These are the test kits. So before we go to the testing procedures, we have to know first how to keep these test kits to avoid the wrong false positives and false negatives. So these test kits, they have to be stored at a certain temperature. It's on the pack. So you can store them up to 2 to 30 degrees. Meaning, if you have a fridge which has the temperature of 2 to 8, you can put them there. Even at room temperature, but make sure that you monitor the temperature. Some days they are hot. You find that the temperature goes up to 30 something, 32, but these ones, it's 2 to 30 degrees. That's storage. Then the other thing, these desiccants, every time you have gotten a strip from the kit, you put them back. You even put back the desiccant. Then there's a ziplock here. You make sure you tighten. Why do we do this? As we know, we have seen most of our RDTs, these are moisture sensitive. So when they get wet, they may give us a false negative or a false positive. That's storage. Then, so for LAM, it also has limitations. So like I said before, it detects mycobacterium. We have different mycobacterium species. We have Mycobacterium leprae, we have Mycobacterium, is it bovis, all those. We also have Mycobacterium tuberculosis. Now looking at our country and our district, we are focusing more on Mycobacterium tuberculosis. That's why it will work for this, because this is a TB endemic area. Yes. So now we can proceed to the test. Okay, so we are going to talk about specimen collection. So for specimen collection, most important thing that you need to have is the right specimen container, which is a plain urine container. We have a lot at the lab. You can order and we will provide. The right specimen container. You also need to have a form. It's also part of when you're collecting samples. Then the urine that we need is midstream urine. Make sure when you are giving instruction to the patient, you tell them no. When putting the sample in this container, the genitals need to be cleaned a bit. Then as they urinate, the first urine should be let out. Then the urine which we need, which is of good quality, is the midstream urine. Then for if you have someone who can do, is it a suprapubic, I don't know, clinicians. Yes, or you use a catheter.
Yes.
You can collect samples like that. Sample storage. So once you have collected the sample, you label the name of the patient. If you are sending them to the lab here, you label patient's name, location, date of collection. You also fill up the form. On the forms, I'm sure Madam Kunda will elaborate more. But the forms we use are just the same. Like you have seen this one. Name of health facility, where you are from, department where the sample has been collected, if it is ART, if it is in the community, if it is OPD, then you put the patient's full names. Here is the sex of the patient, date of birth, even the years, patient's file number, if you have the phone number. Sometimes some patients stay very far. Once you do the procedure, they require a call. NRC number, if you have. What you're doing is what? You're making a diagnosis. It's not a follow-up. You tick on diagnosis. If it's follow-up, you tick on follow-up. Patient's HIV status, they come at the facility. Unknown, these unknown, but facility, do the test for HIV, then you make sure you tick. Unless more community, if the sample is collected in the community, we can understand. Then here, since we are doing urine, you tick on urine. Here, we are not doing expert. We are not doing LAM. You tick on LAM. Then how many samples have you sent and how many forms? You have sent one, you tick on that. Date the sample was collected and time. These, most of the time we tend to miss them, but they are very vital to know how long the sample has stayed. This is how we know at the lab how viable the sample is. Because for urine, we are still on storage. For urine, when you're keeping urine at room temperature, you don't have a fridge. You have to test within 8 hours. So that's where now time comes in. Sample collected around 10. By 18, the sample should have been processed. If you have a fridge with a temperature of 2 to 8, then the samples will be stored there for 3 days. More than 3 days in the fridge, temperature 2 to 8, more than 3 days, that sample is not viable anymore. It can give a false negative or a false positive. For samples that are staying longer, you can put in the freezer -2. Those ones, they take longer, but they come with a catch. So for those samples to be processed, you have to remove them from the freezer, they defrost, then you have to centrifuge. So if you don't have a centrifuge, it becomes a bit of a challenge, because after freezing, they need to be centrifuged because of the particles that are made. We need to get a pure sample. So that's about storage. Now for the procedure itself. So this is our sample. This is our test strip. This is how it looks like. We have gotten one. So after getting one, we are doing one test. This routine should never be missed. Put everything back. Not your kuposaka. Put everything back together with the desiccant. Don't forget to salt you too. The desiccant to prevent moisture. Then squeeze the air out. Then tighten properly. Then those ones are now safe to be used for another day. Then once you get the strip, this is the strip. Here is where we open it from. Have you seen? Here is where we open it from. You can just do that. So this is our RDT LAM. Once you remove this, you have to do the test within 2 hours. Within 2 hours, you do the test. After removing this, within 2 hours, you do the test. If it is more than 2 hours, then this one is no longer viable. You can't use it anymore. You discard and get another one. So this is our test. So if you are doing more than 3-4 tests, you even label on this test to avoid cross-matching of ama results. you may give vachita results yavene. So you label them. You label them. If it is like Madam Kunda, you put Kunda to match the sample. You put, if you have another sample, you do the same, you do the same, you do the same, you do the same, just like that. Then in the lab, we have what we call a micropipette. For that one, it's able to measure exactly. So for LAM, the sample that you need to put on the Kahara DT, you need to put 60 microliter. So 60 microliter equivalent to drops, it's about 1 point something drops. So for this one, since we have a limitation of those microliters, we can just put one big drop.
Okay.
At least one big drop on the specimen, on the sample, on the RDT.
Okay.
So here is where we find the lines for control and the test. And this is where we put the sample. Have you seen these to my arrows? Huh? So we'll collect the sample. Have you seen me? I'm putting on gloves. Infection prevention. Even though they say urine is most sterile. Yes. So we'll get one big drop. So me have collected a lot of a lot of urine. Then I'll put one big drop like that. Then
So I have a question.
yes.
So when you put this big drop here, how long are you supposed to wait for these results to be read?
So the good part about RDT, they are not like these other ones which you wait for hours. So for LAM, you only wait for 25 minutes, not less than 25 minutes. After 25 minutes, your results will be ready for interpretation.
Okay.
So let's wait for our test to run. After 25 minutes, then we'll continue the video so that we interpret the results together. Yes.
Okay. So now, is anybody free to ask you questions concerning this same procedure? Because for some of us, it will be the first time doing it. We've never seen it and we've never done it before. So can anyone who feels like they've got more questions ask you anything?
Definitely. We have that group, TB, Kanchibi under Kanchibi, and all lab personnel are there. So when you have queries, any recommendations or concerning these tests, anything that you have, you can freely post in that group and we are going to respond.
Okay. Thank you so much. So we are waiting for our test to finish.
So our 25 minutes is up. Now we can have a look at how these results can be interpreted. So quality control is one of the things we focus more on the lab. It validates testing procedure or an RDT. So for these RDTs, they come with an inbuilt control line. So this is the control line. You find it here on top when you're looking from the arrows there. So this is the control, and this is where the test is supposed to be found. Interpretations. So this control line validates the test kit. It shows that this test kit is okay to use and there's nothing wrong or the procedure went as planned. If this control line was not to be found here, that will show that the kit or the test is invalid. There may be something wrong with the kit or the procedure itself. So for this one, since there's a control line and the test line has not come out, we can say this is a negative result. So since we are dealing with antigen tests, you would normally see us writing non-reactive.
So I don't have TB.
No, madam, you don't have. Okay. So for the other line here, let's assume that two lines came out. The control line as well as the test line. That will show that the test was what? Reactive. Let's also try to assume that the control line was absent and the test line here was present. That will show that the test is invalid. As I said earlier, the control line validates the test. So if the test line comes out and the control line is absent, that's an invalid test. Then if it comes out blank, no lines, it's also an invalid. Yes. So that is all for our video. For any questions, as we said earlier, you can communicate through the portal. There are lab personnel there will be more than willing to help. So for these clients, patients that you are suspecting TB, after doing urine LAM, you can also send samples for sputum. So for adults, you can kindly send sputum. For children, you can collect stool. You can also send stool for gene expert.
That was a demonstration from our lab tech. Thank you so much, boss. Hope everyone will be utilizing and using those kits that I distributed yesterday. So we need to use those kits before 21st of January. Thank you so much. If you have any questions for him, kindly feel free to WhatsApp it on the same forum for Kanchibiye TB stroke leprosy forum.